Good afternoon. I'm Greg Cox, Chairman of the San Diego County Board of Supervisors. We're here today to discuss new developments in the ongoing coronavirus or COVID-19 crisis that we're dealing with. First, let me start off by introducing some of the people that are up here. Behind me, we are joined by Supervisor Nathan Fletcher, who is serving as the Board Coronavirus Subcommittee along with myself. We are joined by Dr. Wilma Wooten, our County Public Health Officer, Dr. Eric McDonald, the Director of County Epidemiology and Immunization Services Branch. Also, we have with us Dr. Nick Efantides, the County Chief Medical Director, and we are also joined with some representatives from the Health Association of San Diego and Imperial County, which includes Demetrius Alexio, who's the President and CEO of the Hospital Association of San Diego and Imperial County, Chris Van Gorder, the President and Executive VP of Hospital Operations, Chris Van Gorder with Scripps, I'll get it right. And then also Dr. Patrick Frias, who's the President of Rades Children's Hospital, and Dan Gross with Sharp Hospital. The County of San Diego remains committed to addressing this emerging health crisis with working with our local cities and other agencies. We're all working together along with our federal and state partners on what actions to take. Yesterday, Governor Newsom issued important new guidelines. We've looked at the recommendations and guidance the governor has provided and have come up with an updated legally enforceable public health order that will apply to our region. You will hear the specifics of that order in just a couple of moments. I want to emphasize that everything we've developed has been with the guidance of federal and state public health officials from the Center for Disease Control and Prevention, from the California Department of Public Health, and our local hospitals, and of course, our county public health experts. Our partners have been great to work with. We're as unified as we can ever be, and it's very reassuring to see the cooperation amongst our various cities and local governments, including also schools, community and faith-based organizations, businesses, healthcare, long-term care facilities, military, our homeless providers, and other sectors, all working together to avoid the spread of this virus any further. We're working with our local jurisdictions to install hand washing stations across the region. A total of 238 have been requested, and 180 have been placed, with the remaining 58 being replaced by the end of the day today. Today, you'll hear updated directions and guidance in our attempts to slow down the spread and protect our most vulnerable populations, like older adults and those with underlying conditions. We're not trying to be perfect, but we are trying to do the most good for the most people to help flatten the curve. We're also working with our local hospitals to increase the capacity of testing for the virus, and we have representatives from our hospital association here today to respond to any questions you may have. Before we introduce our speakers, I do want to reiterate to the public to please heed the guidance that is going to be provided today. Please practice safe hygiene, and please practice social distancing. This is not the time to be complacent. We are in a real, fast-evolving health crisis, and we need to do everything that we possibly can to prevent the spread of this disease. I know the measures we're talking about may be difficult. I know that people's lives are being upended and being affected on a daily basis. But we will get through this. That's the important thing. We will get through this. Let's help each other. Let's be smart. Let's be calm. And most of all, let's be safe. Now, please let me introduce our first speaker, which is Supervisor Nathan Fletcher.
Thank you, Chairman Cox, and thank you to everyone who's here. There is no doubt that we are dealing with a dynamic and ever-changing environment. Dr. McDonald and I were talking about the closest environment that probably exists to this as being in a combat setting. We've both been in combat settings and environments where you have ever-changing information, often not clear or complete information, and you're making a series of decisions based on the facts as best you know them, recognizing that at any moment or any period of time that they could change. But also, like a combat environment, in those situations, you have a team, and you are one team. And I think that the people of San Diego should take comfort in knowing that at least for us here in San Diego, this is not a jurisdictional issue, this is not a partisan issue, this is not one entity versus another. When we stood before you before, we had mayors and state leaders from across the sector standing in unison. Today, we're joined by our hospital partners, representatives of our major hospital systems. We have extensive meetings and conversations. When they need help, we help them. When we need help, they help us. And we will continue that with all of the sectors and all of the areas we are doing to advance through this difficult environment, making the best real-time decisions that we possibly can. We are going to today announce a series of actions that we are taking via a public health order. And I do think that that is an important point to reinforce. As you see a number of jurisdictions making a number of actions, we are making the actions with the advice and counsel of our public health experts and doctors, and we heed their advice. We heed their direction, and we move forward accordingly. But all of us have a complete understanding that at any moment these could change. We could very rapidly be in a situation where we are back before you with much more severe, much more drastic, and much more restrictive actions. And as a public, we should prepare not only for the increase in number of cases, the increase in the significant impact of those cases, but the potential increase in additional steps. With that in mind, today we are issuing a new amended order of the health officer and emergency regulation for San Diego County with new guidelines and new direction. The 11 new orders, which I will briefly read, and then Dr. Wilma Wooten will cover and be happy to answer and question in more depth. Number one, all public or private gatherings of 50 or more people are now prohibited. All non-essential gatherings of any size are strongly discouraged. So although we are moving the order from 250 to 50, we are strongly discouraging any gatherings of non-essential operations or non-essential functions. Nobody needs to have gatherings for St. Patrick's Day. These are the types of things that we are asking folks to come together and adhere to. Number two, all bars, adult entertainment establishments, and other business establishments that serve alcohol and do not serve food shall close. Again, all bars, pubs, entities that do not serve food shall close. All restaurants and other establishments that serve food shall close all on-site dining. All food service shall be by delivery or through pickup or drive-through. Social distancing shall be required for persons picking up food on site. So again, all restaurants throughout San Diego County, in-person dining is legally closed in San Diego County. All businesses shall enact social distancing and increase sanitation standards and shall make every effort to use telecommuting for its workforce. All businesses shall suspend any policy or procedure requiring doctor verification for sick or other leave approval. We do not need individuals crowding our doctor's time and showing up at our hospitals asking for a doctor's note. So all businesses shall suspend any policy or procedure requiring doctor verification. Number five, all public or private schools, colleges, and universities shall not hold classes or other school activities where students gather on the school campus. Parents of school-aged children shall take steps to ensure said children are not participating in activities prohibited by the order and that social distancing requirements are practiced. Number six, a strong recommendation is made that all persons who are 65 years or older, have a chronic underlying condition, or have a compromised immune system shall self-quarantine themselves at home. A strong recommendation. Number seven, non-essential personnel as defined in the order are prohibited from entry into hospitals or long-term care facilities. All essential personnel who show any potential signs or symptoms of COVID-19 shall be strictly prohibited from entry into hospitals or long-term care facilities. Number eight, hospitals and healthcare providers shall take measures to preserve resources, including delaying non-emergent or elective surgeries or procedures where feasible. Number 9, hospitals, healthcare providers, and commercial testing laboratories shall report all COVID-19 test results to the public health officer immediately after such results are received. Number 10, all persons arriving in the county from locations as found on the Center for Disease Control and Prevention Warning Level 3 travel advisory shall be subject to 14-day home quarantine and self-monitoring. This includes originating or connecting flights from the countries including South Korea, Japan, Italy, China, Iran, along with any other country that is subsequently added to this list. Number 11, a strong recommendation is made for persons exhibiting mild to moderate symptoms of COVID-19 to self-isolate themselves in their place of residence until seeking medical care and treatment. We will have additional guidance on child care facilities. We are waiting for some state input and direction and guidance, along with some continued internal deliberation, but folks should stand by for these orders. In addition to the public health order that's being issued today, we want to update you on our efforts around the homeless. We are particularly aware of the prevalent danger associated with COVID-19 for vulnerable populations, and we've been taking a number of proactive steps to try and protect these populations. Hand washing stations, which was mentioned, are put out across our region. To date, we have placed 180 hand washing stations in 13 jurisdictions, including MTS and NCTD. We have 58 additional hand washing stations that have been requested. All 58 are being delivered today. We stand by and ready for additional requests, and when we receive those requests, we will fulfill those requests. Our public health nurses have been deployed to the region's bridge shelters. There are teams of public health nurses in each of our bridge shelters that are working there daily. They are offering training to shelter staff, but they are also screening hundreds of unsheltered and homeless individuals on a daily basis. These screenings include temperature checks of those patients. I went out to the Alpha Project shelter with Mayor Kevin Faulkner to check on the operations. I'm pleased with how it's going. And I just want to say I'm incredibly appreciative of our public health nurses. At a time when what we're asking most folks to do is stay at home and binge watch Netflix, our public health nurses are out there. They're in the rain. They're engaging with vulnerable populations. They're checking their temperatures. They're offering them aid and assistance. And our public health nurses are our frontline workers, and we are incredibly grateful for what they're doing. In addition to the efforts in the shelters, we have hot and foot teams that are out engaging unsheltered individuals who are not in homeless shelters. They are covering many areas of our region, and they will have public health nurses with them as well. We have 1,300 hygiene kits that our foot teams will be delivering starting tomorrow. These hygiene kits include information on COVID. They include soap and water, hand sanitizers, and other types of information, because we're trying to get engaged with everyone possible to make sure they're adhering and make sure they're getting the news about the resources that are available to them. Last point on the homeless, we have secured 227 motel rooms. These rooms are available to anyone who is a person under investigation, a person who is showing symptoms or a positive test, who does not have a home or cannot return to that home for isolated care. These facilities are staffed with health access personnel, food is provided, transportation, we've engaged cleaning and hygiene as well as security. Our aim presently is to acquire 2,000 motel rooms that could be used to try and shelter and help this population. That number could also increase as we move forward. Again, I want to reiterate, these rooms are designed for vulnerable populations who have been exposed to COVID-19, who are exhibiting symptoms of COVID-19, who are pending test results of COVID-19, or who are tested positive and cannot isolate themselves at home. These could include homeless and unsheltered individuals. They could include seniors in assisted living or senior homes who can't return to this. It could also include any member of the public who is suspected or positive but does not have the opportunity or availability to self-isolate at home. We know that there is a greater need for additional shelter capacity, particularly for the homeless community. We also know that the state of California, per Gavin Newsom's directive, is moving to acquire more rooms and provide trailers and more options. I also know the Regional Task Force on Homeless is moving aggressively to also get additional motel room capacity. We are supportive of all of those efforts. We will coordinate with all of those efforts, and those rooms will be designed for homeless individuals who are not showing symptoms or signs or at risk. But to be clear, the rooms we have are reserved for those individuals who we believe have been in contact or at high risk of having it. We've also requested the Mercy Ship be made available from the Department of Defense to aid in expanding our healthcare capacity, and our local congressional delegation is engaging us to be supportive of that request. Finally, in all of the sectors that we've outlined from the very beginning of this, we continue to engage with them all regularly, whether they be remote calls, telecalls, conference calls. Those are our business communities, our schools, our city and government officials, our healthcare sector, our faith-based communities, and others, and we will continue those engagements. We also have dedicated county staff assigned to each sector, and that county staff is there to be a resource every single day for anything that members of each of those sectors may need. Last point I want to make is we have had a request for individuals to continue to donate blood. As our society slows down and things slow down, people stop doing those types of things. And so we are asking and encouraging San Diegans to reach out to their regional blood bank participant to contact them and make arrangements to go and to donate blood so we can maintain the adequate supply that we need in our region. As we continue through this, we ask for your continued patience and cooperation and understanding of it. And then in closing, I just want to say that in most of these situations, as a community, when we say we come together, we actually mean we physically come together. We come together in candlelight vigils. We come together in houses of worship. We literally lean on one another. In this instance, in this time, we are still asking the community to come together. We're just asking you to come together in a different way. Proximity is not the option in what we're doing, but purpose is. And we're asking people to have a shared sense of purpose. Every single one of us has within our control the ability to slow the spread of the coronavirus. We have the ability to slow the spread of it by the actions we individually control and that we can take. And that's not just protecting yourself. That's protecting a senior citizen or someone who's vulnerable who you might spread it to. And so we are asking people to continue to heed these warnings and heed this advice and remind everyone that fear, COVID-19 can't detect fear. Being afraid or being anxious will not stop you from getting this. Channeling those emotions into positive action, those are the things that we can do to come together and try and stop this. Lastly, this morning we announced the San Diego COVID-19 Community Response Fund. We started with $1.3 million. We have already received substantial donations and contributions to that fund. This is a fund that's designed to provide help and assistance to our most vulnerable folks. If you live paycheck to paycheck and you're not getting a paycheck, you could be in a very dire strait. And although we're waiting on state and federal assistance, the reality is that may take a little bit of time. And so we are prepared now in partnership with the San Diego Foundation and the United Way to begin immediately providing assistance, rental assistance, food security assistance, income replacement to vulnerable communities throughout San Diego. And so we're asking San Diegans to visit sdfoundation.org/COVID-19 to make a tax-deductible donation. It's another action that we can all take to help one another. So again, thank you all for being here. And in particular, thank you to our incredible county team of public health experts and doctors who are working tirelessly to best inform the policy decisions we're made to protect the public. Thank you.
Thank you, Supervisor Fletcher. The directives that Supervisor Fletcher just talked about, in which Dr. Wilma Wooten is going to emphasize, will take effect at 12 p.m. tonight, midnight. So with that, I'd like to introduce our County Public Health Director, Dr. Wilma Wooten.
Thank you, Chairman Cox, and thank you, Supervisor Fletcher. So good afternoon, everyone. Our current situation for COVID-19 is rapidly changing, not just every day, but sometimes every minute, maybe even from hour to hour. Globally, the novel coronavirus, which is causing COVID-19, has infected at least almost 180,000 individuals worldwide in 155 countries and is implicated in over 7,000 deaths. Nationwide, in the United States, we've had almost 4,200 cases reported associated with 71 deaths. In California, we've had 335 cases and 6 deaths reported. And in San Diego, Today, we will be reporting 55 cases, which included 47 San Diego residents, 4 federal quarantine individuals, and 4 non-San Diego County cases. So this order is issued based on the increasing transmission of COVID-19 nationwide, including San Diego. All of our actions taken up to this point are taken to reduce the significant risk of widespread introduction and transmission of COVID-19 into our county. The directive issued here today includes actually 9 specific orders and 3 strongly recommended, strong recommendations. And Supervisor Fletcher has gone through the orders. The 9 actions or directives are associated with private gathering. And we want to emphasize that while we are specifying that we are prohibiting gatherings of 50 or more individuals, we really would like everyone to consider non-essential gatherings to not do them. So we are strongly recommending that any gatherings of any size, if they are not essential, to not do them. All bars, adult entertainment establishments, and other business establishments that serve alcohol and do not serve food, we are ordering them to close. All restaurants and every business establishments or other business establishments that serve food shall close on-site dining. So we are recommending or ordering that the businesses allow individuals to either pick up or drive through. And again, when people are going to pick up, we encourage you to still adhere to the social gathering, the social distancing guidelines that we have already provided, and that is 6 feet apart. And as you can see, everyone here today is following that guidance. So businesses shall also enact social distancing, increased sanitation standards, and shall make every effort to use telecommuting or working from home where at all possible. And also, all businesses shall suspend any policy or procedure requiring a doctor's note. And I think that's very important because a lot of time will be wasted, and people who potentially have been exposed or might be infectious could potentially infect others trying to get a doctor's note. And then all public or private schools, colleges, and universities shall not hold classes. They can hold classes remotely or online, and many of our colleges and universities have already taken those steps and actions. As was stated, we will be coming back with additional guidance about child care facilities, but that will not be included in the orders that we are providing today. And then non-essential personnel are prohibited from entry into any hospital or long-term care facility. All essential personnel who show any potential signs or symptoms of COVID-19 shall be directly prohibited or strictly prohibited from entry into hospitals or long-term care facilities. Hospitals and healthcare providers shall take measures to preserve resources, as well as this includes delaying non-essential or non-emergent surgeries or procedures where possible. And then all persons arriving in the country, and this is another important one, we already get line lists for China and for Iran. There are other people coming from other countries such as Italy or South Korea, and we will be issuing quarantine orders for those individuals so that they can stay at home and monitor or self-monitor their condition and report any issues to our health department. Now, we've talked about the actions, and I just really want to reemphasize 3 strong recommendations. The first has been given, and that is that all non-essential gatherings of any size, ignoring the 50 number that we've provided, but any size, if it is not an essential gathering or event, please do not do it. And then a strong recommendation is made that all persons who are 65 years of age and older have a chronic underlying condition or have a compromised immune system, that they stay at home. And then the third strong recommendation is for persons exhibiting symptoms of COVID-19 to self-isolate themselves in their place of residence until they need to see a physician. But if they don't need to see a physician, stay at home. Don't go to a party or friend's house, because you are then exposing those individuals to your disease. So again, this order is issued to slow the transmission of COVID-19 and include best practices as currently known and available to us to protect vulnerable members of the public from avoidable risk of exposure to COVID-19. Although most individuals who contract COVID-19 do not become seriously ill, persons with mild symptoms of COVID-19 may place other vulnerable individuals at risk, such as older adults and those individuals with underlying conditions. COVID-19 affects all individuals of all ages. Our local cases range from early 20s to the late 80s, and we expect that more cases will occur. We know that more cases will occur. We know that we will have eventually deaths, more deaths, and we will issue an order related to child care facilities after guidance from the state. So in conclusion, everyone has a role to play in decreasing the spread of COVID-19, and we implore the general public to play their role and help protect the lives, the health, and the wellness of all other residents. So I would now like to invite Dr. Eric McDonald, who will provide information about testing, and that's another important issue that we want the general public to know about. Dr. McDonald.
Thank you, Dr. Wooten. Testing is increasing in the community, but is still not yet widely available in San Diego County. We expect this to improve in the next 1 to 2 weeks. So until testing is widely available, only those who need medical care need to be tested. If you are not having symptoms, you don't need a test. If you are sick with mild symptoms, stay home, isolate yourself, you don't need a test. If you need medical care, contact your provider by phone and follow their instructions. Providers will know who to test and arrange for it if they can. We are having increased reports of positive tests from hospital and commercial laboratories, and these are included in the results that Dr. Wooten just gave. Our public health laboratory has limited capacity, up to 120 tests per day, and we're using specific criteria to determine who is tested with our public health lab resources. The public should not directly call public health for testing. You must go to a provider for this, and most tests will be done in a commercial laboratory. Public health centers are also not places where we provide testing or sample collection. Our laboratory no longer needs to send samples to the Centers for Disease Control for confirmation. So there are no more presumptive positives. All of our tests are now final. Our public health laboratory is working with the local hospitals to confirm their laboratory tests, and after a certain set of samples have been confirmed as either positive or negative, they will no longer need to send tests to us, and their tests will be confirmed or acted as positive. We are acting on the results that we get from the hospitals and the Navy laboratory to take public health actions. And I'll turn it back over to, who's next? I'm sorry. Oh, Supervisor Cox, sorry.
At this point, we'll open up to any questions. Yeah, go ahead.
For those that are trying to get tested, I understand that it's not widely available yet, but they're being told to call their physicians and there's a COVID-19 hotline. We've had a lot of viewers who have called in and said that hotline says sometimes 2-hour waits. What do they need to do in that situation if they do feel that they are sick and
Okay, Dr. McDonald?
Sure. Each medical system has their own mechanisms to address their patient populations. There are nursing hotlines and call lines in for most of the major systems that are here. I know there may be a wait for some of those, but again, what I would urge people to do is if they feel they need medical care, they should be contacting their medical providers directly through normal medical channels. For testing, that's slightly different.
Let me also ask Chris Van Gorder if he'd like to come up and comment on that.
Chris Van Gorder, President and CEO of Scripps Health. We have a nurse call line that a lot of folks are coming in or calling on, and over the weekend, the wait actually was about an hour and 15 minutes. That's down this morning to 12 minutes because we've doubled and almost tripled the number of nurses that are on the call line. The other thing we've been able to do is we've been able to test about 80 patients a day, but because of Nathan Fletcher and Scott Peters' help, the CEO of Hologic, which is a company here in San Diego, has a very special piece of equipment called the Panther Fusion. That arrived at Scripps today, and so as of about a week from now, maybe a little bit better than that, we'll be able to run about 500 tests a day. I want to mention Patrick from Rady as well. They're working on some genomic opportunities to run a lot of tests through as well. So all of us are working together as a group of hospitals and working with public health to try to increase our testing capability.
Okay, question over here. Dr. Wooten?
We are considering all tools in the toolbox, and as I stated, what we are proposing here today is today. We may be back tomorrow or even the next day with more enhanced and more restrictive orders. But every location is different. But we do recognize that nationwide, we will ultimately get to the point where there is countrywide lockdown, and I would just say that that probably is coming and very soon. Right now, this is what we are, based on the evidence and the information that we have for us, for San Diego, and we've consulted with our community partners as well. It's not just a decision that's made by the county of San Diego.
What you're going to hear a lot, I think, in this conference and subsequent conferences is the phrase, "at this point in time." Obviously, this is an evolving situation, and there will be other steps that will be taken in the days and weeks ahead to address this crisis. Yeah, Artie?
Yes, that is correct. Well, a small percentage of those cases actually do come from some of the hospital and other laboratories that are still confirming with us. So I'll have to give you an exact number of how many of them are presumptive, but we're acting as if they're all confirmed, and I have no doubt that they will be. I don't have those details for you at this time. Some of those individuals are individuals that have left the location of the state. Some of them have left our county. I would say that most of the cases are either currently on home isolation or in the hospital, and there are two that I'm aware of who have been discharged from hospitals and are recovering.
Okay, question here. Dr. Wooten?
So as you know, every year we have influenza, and there are multiple strains of influenza, particularly in the vaccine. We are not aware of any drift or shift in the genetic composition of this particular virus. What we will know next year this time, the virus could be like influenza, but we don't know that now. Right now, the current virus is one strain that we are aware of, this novel strain. And that's what the vaccine will be developed for, this particular strain. The thinking is that no, you could not get it again. Again, with influenza, there are multiple strains, so you could have influenza A, get over that, and then develop symptoms associated with influenza B. Since this is just one strain, the current thinking, and we are operating on the current thinking, but in the future, more research will be available. Again, well, this coronavirus there is no treatment for it. There are no antivirals. There is no preventive vaccine. So when people are admitted to the hospital, or if you stay at home on home isolation, you treat your symptoms. If you have a fever, take antipyretics. If you are dehydrated, drink fluids. So it is, treatment is supporting the symptoms that you have.
Okay, question over here.
I know some people we talked to yesterday about what Governor Newsom said. They were saying, like, is this really something we need to do? Like, they were thinking it's really drastic, closing bars, closing restaurants, or limiting to takeout. So I guess if you could first address that, does this really need to happen? And in your contact investigations, have you found that people are testing positive in bars and restaurants?
Well, people are everywhere. So of the 55 individuals that are on our line list as being positive, they've been multiple places and probably been in places we don't even know about, because you know how recall is. So it is important that we separate those individuals that have symptoms from those individuals that do not. And social distancing strategies is the best evidence-based intervention to do that. And all of the actions that we've recommended today fall under the category of social distancing strategies. And we really want to protect our elderly and individuals that are that have the greatest risk of developing complications. So that includes our older adults. It includes individuals that have a compromised immune system and chronic health conditions, much like influenza. Grocery stores are essential. You have to eat, don't you? So they are essential, but we have guidelines, or will have guidelines. The social distancing strategies will also be recommended for grocery stores as well, but we are not closing grocery stores. I think Dr. McDonald or someone else. Okay, all right.
Okay, let's go to a question back over there.
The county's just paying for them. We're just writing a check to pay for them. In terms of where they are, they're at locations throughout San Diego County. I don't think it would be wise or prudent for us to publish a map or a listing of where these are. But we are taking the ones that we have and moving aggressively to get more. There happen to be a whole lot of motel rooms available these days. And so we have not had a shortage of partners willing to engage with us in making them available and providing them, and so we will do that. In terms of how an individual would get access into the ones that we have, it would be a referral from a public health nurse. So if you're at the shelter and the public health takes your nurse and you have a temperature, they're going to direct you to one of these rooms. It's potentially, if you're at a senior center and you exhibit symptoms or signs, they will contact us. We will direct you to one of these rooms. It could be one of our healthcare providers who treat someone, assess someone, but they don't need to be in the hospital. And if they don't need to be in the hospital, but they can't go home, we want them to have a place for them to go. And so again, you know, Lisa, right now our focus is on those vulnerable folks who are showing symptoms, who have been in contact, who are awaiting a test result or are tested positive. That is the highest priority we have right now. And the aim and the effort in this is to try and stop an outbreak. Particularly in congregate care settings, whether they be senior homes, whether they be homeless shelters. And so we're taking every action we can to try and do that. I recognize that there is a greater need for other individuals, particularly who are unsheltered, to have access to shelter, and we fully support that. That's where the state of California and the Regional Task Force on Homeless are working to secure additional opportunities for individuals who aren't exhibiting signs or symptoms or haven't been in contact, and we will support in every possible way that effort. And if there reaches a point where we have greater capacity in ours than need, then perhaps we could reassess and reevaluate the prioritization of what we're doing. But our public health nurses in our shelters, our public health nurses that will be out with our hot teams, along with our partnerships with our medical providers, our outreach to congregate care and senior centers will provide the access point into these rooms.
Okay, let me go back over here.
Businesses that are being asked to close, what are the steps that they need to start taking, or are there any in place to be compensating them for wages lost? And is that coming from the state level, county level? If you just step us through that process.
You want to do that?
So there is a form that we will make available for small businesses that have been impacted to fill out. They can submit that to us, and then they can get in the process in the queue for reimbursement. We do think that there is going to be a lot of economic help and assistance. We certainly hope there will be, particularly from the federal government for those individuals. There's no doubt this is having a significant economic burden, and we're very sensitive to that, but we're more mindful that the actions we take are driven by protecting health and life. And so we ask them to please comply with the order. We would also remind them the portions of this order that are legally enforceable. It's not a request, it's not a suggestion, it is a legal order.
Okay, back over here.
A gym is a business, and we're asking them to adhere to the same guidance, not guidance, but actual directive and the order. "50 people or more is the order, is prohibited. So modifying their business structure or their business process, again, the 6 feet, social distancing, enhanced sanitation processes, we are asking them, all businesses, to do the same thing. We recognize that in some jurisdictions, it explicitly states businesses, but we collectively, that entity, a gym or a fitness facility, is included in the general term of business. Yes.
So they can stay open just so long as there's fewer than 50 people in there?
And the social distancing. That is the current guidance today. But again, that could change. We are working that process out.
We also just on that point, we shouldn't have to go out with law enforcement and adhere common sense. We shouldn't have to go out and take first responders who have other things that they need to be doing to have businesses comply with what we know we need to do. And so it'd be our strong hope that businesses would take the legal order along with the intent and the advisories and the guidance and adhere to that, because I got to believe that that business cares about their members, and they care about the folks who come in and out of their place every single day. And so our hope would be that folks would take seriously the risk and danger posed by this and would not put us in that situation where we would have to divert valuable resources to get folks to do the right thing. I would say that there's a reason why we are back closing bars. So we gave some pretty clear guidance and some pretty clear suggestions, and so now we're back taking this. And if these are not, then we will continue to take additional steps to make sure that we're protecting public health.
Okay, question over here.
Mm-hmm. Certainly. There are a lot of myths out there, and based on the evidence and the research that we have today, we are not aware that people can transmit the disease without symptoms. That's the simple answer. That's one of the myths that are out there. People think that if you don't have symptoms, you can transmit the disease. There are studies going on where asymptomatic people are being tested to determine if that in fact is true, but we do not have the results of those research data at this time.
Okay, question over here. Hold on one second.
Again, if I could clarify too, again, there is research that needs to be done in this specific area. But I think the important point is that that people who are asymptomatic don't contribute to propagation of the outbreak. That is to say, there may be very small numbers of cases in which an asymptomatic person may transmit it to another. But that's not what's causing the outbreak in the community. And that's why we make the break point about what people should do as to whether people have symptoms or not. So I hope that clarifies it.
Okay, over here.
I had another question, just a clarification. When you talk about the 50 or less people, I mean, we're talking like movie theaters, grocery stores, our own offices, foreign border cruises, like everything, 50 or less people.
That is correct. The guidance, I don't have that ordinance or rather order with me, but it is available, and it defines what it is: indoor, outdoor, any activity under one roof, any event, 50 individuals or larger is prohibited.
And just another clarification on something you and Supervisor Fletcher talked about in terms of like scaling up and we should be preparing for more restrictions. I think you talked about a country-wide shutdown. What should we be preparing for? What could be coming restriction-wise in the next few days?
In the next few days, I can't say, but in terms of when we talk about a shutdown, that could be something that's in effect, depending on whether it comes down from the federal government, from the state, or even locally.
And then in terms of testing, have you guys looked at those drive-through? I know you guys said before you were looking at drive-through testing. Is that coming online soon?
We've already piloted it last week, and we will be implementing it in the very near future.
Do you know what that capacity to test might be? Like, I think right now you said 120 a day at the county lab. Any idea like what you guys are trying to scale up to, like 10,000 a day, or is that?
Not 10,000 a day. Again, remember, this is not for the general public or anybody who thinks, I want to go down to wherever and get a test. This is for individuals that have contacted their primary care provider. And these are the individuals that don't need to be in the hospital. So it's a strategy to help to not overburden our emergency departments. So we actually have worked out the process, and we will be unveiling it very soon.
One more. I know a lot of people say that, like, when we do these stories, they say, oh, the media is overblowing this. It's really not that big of a deal. I hate seeing all this coverage on the news. I guess, what would you say to that?
This is a big deal. This is very serious. People are dying, and these are strategies that we are implementing, social distancing strategies that are tried and proven that help to decrease the spread of any pandemic. Right now, we're dealing with COVID-19.
Okay, we'll take one more question. Artie?
Yeah, over the weekend, we heard from a couple of UC health workers who were expressed concern about the protective equipment. And in fact, two UC health workers did test positive for coronavirus. So what assurance are we giving to all of our health workers who are dealing with this, quite nobly, obviously, to assure that they have the personal protective equipment to get through this?
Sure. Let me take that in two parts. One is that it's important to know that the UC workers who tested positive, it had nothing to do with their healthcare activities. I mean, that's very important to emphasize. Number two is there are expected shortages of a number of different types of personal protective equipment. We are working with our hospital partners to actually have strategies to lower the use rate of those individual pieces. And I think if you heard the presidential news conference earlier, they're working at a national level to increase the supply. So I think that it is important for people who think they need a mask, they don't if they're not in healthcare. That's number one. And then those in healthcare actually need to be working with their occupational health to understand when specific pieces of equipment are needed for specific situations. And that is a learning process. And I think it's one that's actually is quite successful in the different healthcare environments that we've been working with. So I think we'll see the use rate go down and we'll see the supply go up. And again, with both of those, we hope to not have any mismatches in supply and demand.
Okay, if there are additional questions, we can deal with them one-on-one.
I think for a lot of San Diegans, our hepatitis A outbreak that we had is something that people remember, and I would ask Dr. McDonald or Dr. Wooten to answer, how is that response driving or dictating some of the decision-making that's playing out right now, and even with the earlier emergency declaration that was done in February 14th?
Well, that can be answered in several ways. With the hepatitis A outbreak, it wasn't throughout the nation. That actually occurred after our outbreak was declared over. And secondly, the method or mode of transmission, but I can say that the hepatitis A outbreak has had an impact on our response to making sure that we take care of the homeless population as it relates to COVID-19.
Okay, we're going to cut off the questions. If there are questions, you can ask as a follow-up. Again, before we conclude, let me just reemphasize that this is a crisis, obviously, that is evolving day by day. As we've made comments previously, everything we're doing right now is in reference to this point in time. There will be conditions and circumstances that change that will dictate additional directives and orders that will be provided by our Director of Public Health. So what we will try to do in order to provide current information to everyone is we're planning on scheduling these press conferences at 2 p.m. through at least Friday of this week so that we can keep people up to date with the latest information. If there's any changes in directives or orders, we will certainly be providing that. And we ask everyone to remain calm. This is a crisis, but we're working with all of our public health professionals, our hospitals, our emergency responders to deal with this crisis, and we will get through this. It's going to be a strain on individuals and our local economy, but we will get through this. And so we ask everyone to please use common sense, wash your hands, keep a social distance of 6 feet away from other individuals, and help us work through this situation. With that, we'll go ahead and conclude the press conference, and if there's additional questions, we'll be able to do those one-on-one. Thank you.
You've been listening to a news conference from the county supervisors. Supervisor Cox leading the way, Supervisor Fletcher chiming in. We also heard from Public Health, our Public Health Officer for San Diego County, Dr. Wilma Wooten. The big takeaway here is all public or private gatherings are strongly discouraged, and they did say these are legally compelling orders. They don't want to have to enforce them, but they want people to get going on the suspension.